Dementia is a general term for a group of symptoms that affect memory, thinking, problem-solving, language, and other cognitive abilities severely enough to interfere with daily life. It is not a specific disease but rather a syndrome, a collection of symptoms caused by various diseases and conditions. Key characteristics of dementia: cognitive decline, progressive memory loss, difficulty in reasoning, judgment and attention, functional impairment, challenges with daily tasks like dressing, cooking, or managing finances, behavioral changes, personality shifts, mood swings, agitation or depression, communication difficulties, trouble finding the right words, or following conversations, disorientation, confusion about time or place, even in familiar environments. Common types of dementia. 1. Alzheimer's disease. Most common form, 60 to 80% of cases. Characterized by plaques and tangles in the brain. Symptoms include memory loss, confusion, and disorientation. 2. Vascular dementia. Caused by reduced blood flow to the brain, often due to strokes or mini-strokes. Symptoms can include problems with planning, attention, and movement. 3. Lewy body dementia, LBD. Involves abnormal protein deposits in the brain called Lewy bodies. Symptoms include hallucinations, sleep disturbances, and Parkinson-like movement issues. 4. Frontotemporal dementia, FTD. Affects the frontal and temporal lobes. Symptoms often include personality changes, inappropriate behavior, and language difficulties. 5. Mixed dementia. A combination of two or more types, commonly Alzheimer's and vascular dementia. Causes and risk factors. Age, biggest risk factor, especially after age 65. Genetics. For example, a POE4 gene in Alzheimer's. Cardiovascular issues, high blood pressure, diabetes, stroke. Lifestyle factors, smoking, poor diet, lack of exercise. Head trauma, depression and social isolation. Diagnosis, medical history review, neurological exams, cognitive and neuropsychological tests, brain imaging, MRI, CT scan, PET scan, blood tests to rule out other causes. There is no single test for dementia, and diagnosis often involves a combination of these assessments. What is dementia care? Dementia care refers to the support, supervision, medical treatment, and daily assistance provided to people living with dementia. The goal is to enhance their quality of life, maintain independence as long as possible, and manage symptoms effectively. Components of dementia care. 1. Medical management. Prescribing medications to slow progression. For example, donepezil, memantine. Managing coexisting medical conditions. For example, hypertension, diabetes. Regular checkups and cognitive assessments. 2. Personal care. Assistance with activities of daily living, ADLs. Bathing, dressing, eating, toileting. Maintaining hygiene and grooming routines. Ensuring proper nutrition and hydration. 3. Cognitive and emotional support. Memory-enhancing activities, games, music therapy, puzzles. Social interaction and companionship. Support for mood disorders, depression, anxiety. Reality orientation techniques. 4. Behavioral management. Identifying triggers for agitation, aggression, or confusion. Creating structured routines. Using calming strategies instead of physical restraints. 5. Environment adaptation. Safe, clutter-free living space. Labels or signage for orientation. Use of assistive devices, grab bars, memory aids. Secure environment to prevent wandering. 6. Caregiver support. training for family members and caregivers, respite care to prevent caregiver burnout, emotional and psychological counseling. 7. Palliative and end-of-life care, comfort-focused care during the later stages, pain management, support for families during grief and bereavement. Types of dementia care services. 1. In-home care. Professional caregivers provide assistance at home, ideal for early to mid-stage dementia. 2. Adult day centers. Structured programs offering activities, meals, and supervision. 3. Residential care facilities. Assisted living. For people who need some help but not 24/7. Supervision. Memory care units. Specialized facilities for dementia care. Nursing homes. For advanced stages requiring full-time medical care. 4. Hospice care. End-of-life care focusing on dignity, comfort, and support. Challenges in dementia care. Managing unpredictable behaviors. Emotional toll on family and caregivers. Cost and accessibility of care. Stigma and social isolation. Communication barriers. Tips for caregivers. Be patient and flexible. Use simple language and repeat as needed. Establish routines to reduce confusion. Take care of your own health and seek help when needed. Join support groups for advice and emotional support. Conclusion. Dementia is a progressive and complex condition that significantly affects the lives of those diagnosed and their families. While there is currently no cure, appropriate dementia care, medical, emotional, and practical, can greatly improve the quality of life for individuals living with the condition. Effective care requires a holistic, compassionate, and adaptive approach, tailored to each person's unique needs.